Hi, my name's Will. I'm the COO and co-founder of SimConverse, and today what we're going to be looking at is the Educator view on the SimConverse system. If you haven't already watched the learner preview of the SimConverse platform, I'd recommend having a watch of that first. Today, this video is going to be focused specifically on all of the Educator customization and the reporting that you'll have access to as an educator using SimConverse. So with that, let's jump straight in. What we have in front of us is our characters dashboard. You can see I have hundreds of characters in my library. There are thousands of different variations and characters that you might want to use or choose from on the system. We cover all disciplines, all levels of learners from first year of a degree all the way through to practicing professionals. For today, I'm going to use the same demonstration scenario that we had in our learner preview, which was one of our versions of Mary Patel. Now we're looking at the background of Mary Patel. You can see the interface here. We have our image at the top, got our voice preview as well.
This is an example of what this voice sounds like,
Including some of the customization of both our visual as well as the voice itself. So let's have a look at this component first. Click into the change image section, and I have two options here. I can either pick a static image or I can pick one of our video enabled models. So looking at this library, clicking into our different personas, you can see a whole set of different characters here, which we'll think of it as almost like a Zoom call with the SimConverse platform. You can see we've actually copied me in here as well. And we've got Mary Patel in the top left already selected. So I'm going to keep Mary selected for this activity so we can sort of follow through the same narrative. If I want to change my voice as well, we do have hundreds of different accents, different voices. We actually build a lot of these ourselves. So if there are requirements for different accents, they can exist on the platform. So those are our voices. It's one of the things that we might select from for Mary here. Equally though, the bread and butter of the platform is being able to change some of these background materials for the characters themselves. So you can see here we actually have our full character prompt of Mary. So we have the first section, which is basically, think of this as your context. So if I'm giving instructions to an actor, what information do I give them to be able to start the conversation? The second piece is then the facts. So context is kind of like who you are, what you care about, okay, in here. The second piece is then the facts. So these are all of the bits and pieces of information that you can pull from to basically formulate your character. So these are the things that you will be standardizing to as an SP style actor on the platform. The final section here is then your personality. This final section is effectively how Mary is going to play the role as we go through the conversation. Scrolling down the same interface here, I can start to think about some clinical reasoning and adding in some actions and investigations for my characters. So if I need my learners to be able to do things to or for the people that they're speaking with, I can add these in trivially easily in the system. So how does this work? In the action section, if I click into Administrative Morphine, you can see here we have our label. Now this is what's going to appear, and you will have seen in the demonstration video, on the learner's side. So they click an action if they need to do it as part of that clinical encounter. Now this action can really be anything. Could be give them a cup of tea, give them a coffee if I wanted it to. Equally in this case, it's a administer IV morphine. Reasonably generic, but it gives you a bit of a feel for how this action system works. This prompt text, think of this as effectively the information you would give to an actor if you wanted them to change their behavior based on the thing that the learner just did. So in this case, administer IV morphine your pain changes from a 3 out of 10 to a 1 out of 10. Okay. Equally, if we wanted to say something like, I'll use my example from before, provide a cup of tea for comfort. Then in the prompt field, again, thinking of this as effectively an actor that I'm giving an instruction to, you've just been provided with a cup of tea and now feel more at ease in the conversation and are more willing to open up. Okay. A reasonably complex instruction that I've just given it there, and it took me a couple of seconds to write that out and expect that behavior. So we've got just to recap so far, we've got the ability to change the visual component of the individual trivially easily. We can also generate those images themselves. I've then got the ability to change any of these character prompts and background details as I need to, just in case it's not obvious. This is a text field as well, so I can change anything in here. The next piece is then actions. So I've just added one in for this particular activity. And then we've got investigations. So whilst actions were thinking of that as effectively what information would I give an actor if I wanted to change their behavior, investigations are your opportunity to see or hear things that might change the course of the encounter. So in this case, we have the assess surgical site, we have the check vital signs. Now, I'll just click into this. This is a simple image upload. You see we've got Fahrenheit, so obviously this is related to the US accounts. But the idea here is that you can have an image of obviously we've got our wound site or surgical site here, mildly red. So you would sort of ties into the activity here. She's slightly febrile, mildly red, complaining about feeling excessively cold and in a bit of pain after the surgical procedure. So we'd start to investigate things along the lines of sepsis, etc. So any image you want, trivially easy to upload. Could be an audio message as well. So if I needed to hear, say, a chest sound or a cough, I can upload that into this investigation section too. You can see here with the different file types. With that, that is the character component. Now, if I'm going through and I'm changing these, or if I'm adapting content as an educator, I do want to be able to see what my changes do for the individual or for the learner. And to do that is also quite easy. I just click preview character. Now, in this case, I do want to enable video mode, and then I click preview character. Now, I didn't save any of my changes that I made just then, but we'll see Mary from my educator view here. So let's just have a couple sentences said to Mary. Hi, Mary. My name's Dr. Will. I understand you've had a few concerns here today, so I'm here to help best address those if I can. Would you mind giving me a little bit of background?
I'm absolutely livid. I've been ringing for help for over an hour now, and nobody's come to see me. I'm freezing cold. My heart's racing and I'm in pain. What kind of hospital treats its patients like this?
Okay, Mary. So I understand you've been waiting for a little while, so I apologize for the wait. Let's try and see if we can help address this as quickly as possible. So have you spoken to anyone in the past hour about the coldness and the heart racing that you've been experiencing?
No, I haven't spoken to anyone. That's exactly why I'm so upset. I've been ringing for ages, but nobody's come. It's like they don't even care.
Okay, Mary, I'm sorry to hear that. I'll look into why things have been taking so long for you. Before I do that though, have you received any sort of a clinical review today? Has anyone come in to ask you questions about how you've been going since the surgery?
No. Nobody's come to check on me. I'm still wearing the same gown I came in with. This is ridiculous.
So you can see Mary's obviously got quite a personality. As I go through this, obviously the principle of previewing is if I make a change, I want to be able to test if that change has come through in the system already. Now, once I go through that interface, if I do want to end up checking my interactions here, again, nice and simple, so I can administer that morphine. I can also evaluate the surgical site as a learner here. So any of these changes that you make on your authoring interface, you're able to very quickly see what that has as an implication for the learner. Next, I'm going to click into End Conversation Review. Now I can see my transcript. Now in this mode, the focus is really on changes of the character themselves. I'll show you in a moment how we also change our feedback mechanism too. So those are the main changes for characters. And now I'm going to move on to our rubric system. So in the rubrics, once I've built up my own library, or you can use some of our pre-existing library material, I will have a set of rubrics that are relevant to my specific discipline or relevant to my specific curriculum. In this case, what we're going to look at is the rubric that was used just then for, or is usually used on that Mary scenario that you will have seen in the learner preview. Nice and easy for me to add entire sections if I want to. If, say, for instance, I need to evaluate at scale professionalism of my learner group, I can add a new section here, label it professional communication, make that mandatory because I want all of my learners to have to do that. And then I can start thinking about adding in items here. So professional style introduction, which in this case, you want to basically give an example of what good looks like and then ask, did they do the good thing? So introduce themselves with their title, name, and a reason for their visit. Then you ask the question, did they do the good thing? Did the learner introduce themselves by their title, name, and did they provide a reason for their visit? Okay. Simple as that. Now, if I wanted to make that again mandatory, I just click this little button. And now if my learner doesn't do this, they don't pass this section of the rubric. If I want to look at some of these pre-populated rubric items, let's also use this introduction because I think it's the easiest for most people to grok. Here's the title. Again, can change that if I need to. Here's my passing score. So in this case, I need to actually pass 2 of these items to be able to pass the overall section. In the introduction section here, this is the preset rubric item. So if you have your base rubrics on the platform, you can change any of these details yourself. And then here is my pre-existing criteria that I might want to come in here and tweak, for example. So in this case, they've said, what is a high quality introduction? The learner has to introduce themselves. They have to gain consent to have the conversation or the encounter. And then they also have to confirm the patient details. Now you might have other items in there that you want to add in. Nice and simple. just click that transcript item, add it in here. Or if you think for example, that they don't need to gain consent for the encounter itself, you can delete that item. I won't do it because it's live, but that's how easy it is to adapt the rubrics themselves. You can get as specific or as general as you would like. So you saw a very specific example before with my professionalism section, where I've said that actually they have to do all 3 of these things to be able to get the mark. And if they don't do those things, they don't get the mark. Equally, I can be reasonably general. So if I want to say, for example, the only thing I need them to do as part of their introduction is their name, I just delete that section. Did the clinician introduce themselves by their name? Okay. And now I've just made that a very general item on the rubric. So you can get as complicated or as general as you would like with the rubric system itself too. Now, once I've completed my rubric, I can then use that on any of my characters. So if I have a suite of different clinical encounters and I want to evaluate their focus history and assessment capabilities, I can. I just have to set my rubric up once, or you can use one of our pre-populated rubrics as well. If I want to duplicate this rubric and have some slight changes, I click this button here, and then I can come in here and I can make little minor changes to this particular rubric and then reuse it as required. In a few minutes, I can set up entire curricula on the platform using this characters feature that we just saw, as well as the rubrics. Once you set these up, again, they exist in your own library. You could be using any of our thousands of these to save yourself time, but you are also very welcome to come here and make any edits or changes you would like. The next section here is looking into a little bit more of your content management system with our activities screen. So on the activities, I'm going to select the one that we would have done with Mary, so patient assessment and ISBA. In this activity, you can see actually there's a lot going around the encounter and the conversation itself. So think of this as your preparation material, your didactic content, your passive learning. So if I have lecture material or video content, if I have any kind of theoretical material that I need to include here, this is where it goes. Specifically in this first task here, preliminary information for the patient encounter or conversation. Also change the number of attempts that the learner themselves can have. I can go in here, I can look at our instructions. This is again, text field. You can copy in links here. So if you have some existing content that you want your learners to be able to look at before this encounter. So say, for example, it's a very early level learner and they need to evaluate how to correctly conduct a history or an assessment. I give them a link to that material or I copy it into this text field as that pre-reference item. So think of this as your sort of theoretical or background content. Once the learner has engaged in that foundation skill learning, they then move into the next stage of stage-based learning, which is the conversation or the component skill itself. That's where we talk with Mary. Now, in this screen, I can actually do all of the same edits that you just saw me do before on the characters and the rubrics. It's all in one place. It's nice and simple. I can view my character. I can change the version of Mary that sits within this activity. So if I have lots of different activities, but very slight differences in how Mary conducts herself in that activity, here is where I can make those changes. So I can change my base content here. I can change the actions. I can change the investigations for this particular Mary as well. Equally, if I want to be able to come in here and make slight changes to the rubric, I can do it from this interface as well. Same thing that you guys will have seen before, so you'll be familiar with this. Introduction feature, again, edit, adapt, literally any component of this, all in one interface, nice and simple to get familiar with. Takes you a couple minutes to make very dramatic changes if you do want to make those changes. Once I've had my encounter, to have a holistic learning activity, you do then often want to get them to repeat that activity. That's fine. It's pretty trivially easy to add. You can copy it as well. Get those duplications happening, save yourself some time. The next piece is then our documentation grading. So once I've had these encounters, once I've done my foundation skill, I've learnt the material, once I've then gone ahead and tried to execute on that material, I do now want to actually document my encounter. That's this written grading feature here, or written note entry is what I've labeled it in this particular activity. Now, this is my opportunity to start grading on documentation performance. So say after an encounter, I need to evaluate, can my learners properly fill out an ISBA on a document? Can they properly fill out a SOAP note? I just asked them to say something like, so I'll change the section, SOAP note, right up. And then this section here, provide a detailed SOAP note for clinical review. Okay. And now what I want to be able to do is I also want to have something evaluate that. So this is actually our written grading AI models in the platform. Again, I can come in, I can change these rubrics on the written note entry itself too. So we've got the foundation work up here, which is our kind of pre-learning or preparation. Think of this as that kind of content in the system. I then have taken that content as a learner. I've interpreted it, I've internalized it, and now I go ahead and I've had my conversation with Mary. After my conversation with Mary, I then want to look at my SOAP note, or rather I want to document my encounter with a SOAP note. And then after that encounter, in this particular activity, we also have some interprofessional education taking place. I then go in and I talk to Mark. So again, same sort of feature set that you saw before. This is our character interface. I can change the characters of Mark. So in this case, it's the telehealth consult. So I call him and I can change his background detail for Mark as well. If I have any investigations, in this case, it's just a reminder of the background information for the activity. Nice little visual cue for the learner. But you can, of course, remove those as needed. So that then gives an opportunity for the learner to not only have the encounter with the patient, but then go ahead and actually conduct that handover with Mark. Now, the final thing here, final two things, is our reflection and then feedback section. The reflection itself, if adult learners don't reflect, they don't learn. So in the platform, we follow Gibbs' self-reflective cycle by default, but you can come in here and change any of these questions. Think of these as effectively prompts to get your learners to actually reflect on how they went and what they might change next time. Again, kind of just to be obvious, text field. Final piece here is an opportunity to actually receive feedback or qualitative data on the learner's performance. But how do we actually evaluate our learners at large scale when we think about saying, okay, they've gone ahead, they've done all of these activities that I've set up, I've previewed these activities, I can see what my changes have been, I see what the learner experience has been. Once my learner's gone ahead and actually done those activities, how do I then see how they've performed at large scale? If I have 100 learners, I don't want to have to click into every individual one. That's actually our new Insights dashboard. What we want to be able to do on this is see on my rubrics and how I've set up my activities, how are my learners performing overall, as well as then go one step deeper into the granular performance of the learners themselves. So for those who have completed, let's use this version of Mary again, just to keep things consistent. So I'm going to click into this activity and see how my learners who have completed this have actually performed. And you can see 2 of the 16 who have accounts in this particular cohort have actually tried to access and complete this activity. None of them have passed. And let's have a look into the individual grading as to why. So let's look at the talk with Mary. So you can see here that in none of the encounters that the learners had, did they correctly introduce themselves. They did, in 67% of the cases, gain consent, but they didn't correctly introduce themselves at the start of the encounter. This criteria here was using the clinician's name and their role. Okay, so when someone went through this, they didn't do that, hence the 0%. What this allows you to see is as a rubric heat map is effectively how your learners are performing on all of your individual rubric items at a glance. So taking this information, I can now then decide, okay, actually, when I prepare my learner for this activity, in that pre-work section, I need to make sure that I've actually taught them effectively how to introduce themselves, or at least what I'm expecting them to be able to do. So this gives you an ability to look at a curriculum level and say, where are they performing or how are they performing across different parts of my curriculum, and actually start to use this insight, hence the name, to adapt some of your curriculum and teaching methods as well. So this is our heat maps on the system. We've got completion data here, performance data here, all automated, all easily visible. I can export this if I need to, and conduct any additional evaluation if I want, but the platform itself will present this to you in a simple to understand way anyway. Of these learners, of these 2 out of 16, who are the ones who haven't completed? That's really simple to evaluate. Just click on learners. Now you can see here, we have a bunch of people in the not started column. No one's currently in progress, but I can see that in real time on the system if I need to. And equally, myself and Riata have completed the activity down here as well. So if I do need to chase people up, platform will also send notifications, but you are able to export this and chase them up manually if for some reason you wanted to. So far we've covered the characters, rubrics, activities, the insights dashboard, on the SimConverse system. We've covered all of the voices, so hundreds of different voices, hundreds of different video models that you just saw, all of the different customization of the characters and the prompts. We've also had an opportunity to see our insights dashboard at the end of the system too, to now evaluate at very large scale all of our learners' performance and help us actually change some of our curriculum. So that is a SimConverse platform, very detailed demonstration of our education interface. If you have any other questions, please feel free to reach out to myself or the team. I hope you enjoyed the demonstration, and we look forward to speaking with you very soon. Thank you.